Welcome to The Explainer. I'm absolutely thrilled to have you with us. If you're a focused learner eager to really understand the ins and outs of human health, well, you are definitely in the right place. Today, we're mapping out the complete patient journey of kidney stones. We're going to look at everything from how your everyday diet actually creates these painful little crystals, all the way to some cutting-edge, practically sci-fi cures that are completely changing the medical landscape.
And we really need to talk about this because the sheer scale of the issue is literally massive. Get this, about 1 in 10 Americans will experience a kidney stone in their lifetime. That's a staggering number, right? But here is the statistic that should really get your attention. Over half of the people who get a kidney stone will actually get another one within just 5 years. That means if we don't figure out how to stop them, they're coming back for sure.
Okay, let's dive into this. Here is our complete roadmap for today's explainer. We'll start with the kidney stone epidemic, move into how to fight stones with food, uncover the calcium paradox, weigh the medical debate of to treat or observe, look at the future of treatment, and finally wrap up with life after lithotripsy.
Let's kick things off with Section 1, the kidney stone epidemic, visualizing the enemy.
Kidney stones basically form when your urine gets super high levels of minerals and salts that stick together, crystallize, and just build up over time. But, not all stones are created equal. A whopping 80% of them are calcium oxalate stones. They are by far our most common enemy. Then we've got struvite or infection stones sitting at about 10%. Uric acid stones make up another 5 to 10%, and those usually form when your urine has way too much acid. And finally, there are these super rare cystine stones at less than 1%. Knowing the type of stone is literally half the battle because it dictates exactly how we're going to fight back.
Moving right along to Section 2, fight stones with food, proactive prevention.
Probably the most empowering fact you'll learn today is that most of what ends up in our urine is there simply because we put it there, which means proactive prevention is entirely within our control. A major part of the lifestyle approach to prevention is just learning to season your food differently. We're talking about using things like fresh garlic, ginger, cumin, or hot peppers instead of constantly reaching for the salt shaker. Cooking meals at home using fresh ingredients, that's genuinely your best first line of defense. But, okay, before we even get to the food, we've got to talk about fluids. The absolutely fundamental rule for fighting kidney stones is something called the 10 by 10 rule. You basically need to aim for 3 liters of fluid a day, which equals 10 10-ounce glasses of water. It's just a really vivid, easy mental model to help keep your kidneys constantly flushing out those minerals before they ever have the chance to crystallize. Now, let's talk about specific compounds in our food, starting with oxalates. What is it? Well, oxalate is a naturally occurring compound found both in our bodies and in plants. It isn't even a required nutrient for us, but it is absolutely everywhere, and having too much of it can bind with calcium in your urine to form those highly common calcium oxalate stones we just talked about. And this leads us to some incredibly surprising dietary facts. Some of our most popular quote-unquote healthy foods are actually totally packed with oxalates. Honestly, spinach, your trusted healthy friend, has completely betrayed you here. Spinach, nuts like almonds and cashews, and beets are very high in oxalate. So if you're prone to stones, you really want to swap these out for better options. Instead of spinach, try kale or cabbage. Instead of soy milk, switch over to coconut milk or cow's milk. And instead of beets, just reach for cooked carrots or peaches.
Which brings us to Section 3, the calcium paradox. So this brings us to one of the absolute biggest myths in urology. You see, it might seem super logical to avoid calcium if you suffer from calcium-based stones, right? But actually, the exact opposite is true. You need to consume more dairy and calcium, aiming for about 1,000 milligrams a day. Why? Because if you eat calcium-rich foods at the exact same time you eat something high in oxalate, the calcium and oxalate will bind together in your gut rather than in your kidneys. This literally prevents the stones from forming in the first place.
But there is a villain in this paradox, and it is salts. You can think of salt as a thief. The average stone former eats about 5,000 milligrams of sodium a day. You've got to limit this to 2,300 milligrams, which is, believe it or not, just 1 single teaspoon of salt. When you eat excess sodium, it literally pulls calcium right out of your bones and dumps it into your urine, setting the absolute perfect stage for crystal formation. So the crucial point here is that balancing your protein is another fantastic, super accessible lifestyle swap, especially if you happen to form uric acid stones. Eating excess animal protein causes your body to produce way too much uric acid. You honestly only need a fist-sized portion of meat daily. An even better, highly encouraging strategy is to swap over to plant-based proteins, things like lentils, beans, and split peas. They're heart-healthy, delicious, and just way, way easier on your kidneys. All right, moving into the medical realm with Section 4, to treat or observe, the silent stone. Now, what's really interesting about this is what happens when diet and prevention weren't quite enough. Like, what do you do with a completely asymptomatic kidney stone? A stone that's just sitting there in your kidney, causing zero pain. This actually highlights a major ongoing controversy over at the American Urological Association.
Urologists are currently weighing two very distinct paths, and honestly, both are considered acceptable right now. On one side, you have observation. This is a very patient-centered approach that actively avoids overtreatment. Many patients who just watch and wait end up experiencing only mild events later on. But we do know that up to 1/3 of these observed patients will eventually need surgery. On the flip side is early surgical intervention. Proactively removing the stone avoids the severe anxiety of a sudden, unplanned trim to the ER. It prevents the stone from growing larger, and it's generally just a lot easier to remove while the stone is still small. So it's a really complex, shared decision between you and your doctor.
Section 5, the future of treatment, pain-free tech.
But there's some absolutely incredible news that might just settle that surgical debate. And I'm telling you, this sounds like pure science fiction, but it's real and it's happening right now. New technologies are using real-time ultrasound imaging and handheld transducers to manage stones transcutaneously. That means straight through the skin, no cuts required. Ultrasonic propulsion uses focused ultrasound waves to physically push and reposition the stones to help them pass naturally. Meanwhile, burst wave lithotripsy uses high-frequency, low-amplitude ultrasound bursts to safely fragment the stones, causing way less tissue injury than those older shockwave methods. And the absolute best part? These are simple, office-based procedures that require absolutely no anesthesia. Amazing, right?
Let's move to and see how this builds into Section 6, life after lithotripsy, recovery.
So what does the post-operative reality look like for a patient today? Well, if you do undergo treatment, post-op care is highly structured, but it's really very straightforward. According to the Corvallis Clinic, patients can usually return to their normal diet immediately. Your main job is just to keep the urine flowing freely by drinking those 8 to 10 glasses of water. You will need to strain your urine every single time you go to catch the broken pieces of stone. It's actually going to look like brown or black sand or tiny small pebbles, and catching them lets your doctor analyze what they're made of. And of course, you simply watch out for basic signs of infection, like a fever over 100.5 degrees Fahrenheit. It's a very manageable recovery process.
Which leaves us with a totally fascinating question to ponder. With these brilliant new ultrasound technologies basically making treatment a breeze, will kidney stones eventually become just a minor inconvenience of the past? Or will our modern, highly processed, incredibly salty diets keep these crystalline enemies sticking around for generations to come? The power to decide might just be sitting right there on your dinner plate. Thank you so much for joining me on this explainer. Keep taking charge of your health, stay curious, and I'll catch you next time.